So what causes obesity? Well, this slide shows us that there are different arrows pointing towards obesity. In fact, that's true. The causes of obesity are multiple. There is no single cause that we can point at and say, this is the cause of obesity. In fact, we know that the environment the person lives in, the lifestyle they carry, the type of food they eat, the availability of exercise or physical activity within their life are very important factors in the development of obesity. However, we also know that there are other very powerful factors, including the genes a person is born with. That is very important. So our biology, what we inherit from our parents, is very important in determining whether our life will be a struggle with weight or will be okay. In fact, there are people, and many of us probably know them, that may not be that careful in what they eat, and probably they don't exercise much, but they never really struggle with weight, or whether when they need to drop 5, 10, 15 pounds, they can do it without any problem. These people are not very found very frequently, but they do exist, telling us that the genes, the biology of the person is very, very important in driving the tendency towards obesity. There are other factors as well, like for instance, there are certain medications that are prescribed for different reasons that could drive the obesity. Lack of sleep by itself, or being at a level of obesity that's high enough, also by itself is a risk factor for additional gaining of weight. Once we reach a certain weight, it becomes exceedingly easy for us to gain more weight, but extremely difficult for us to lose weight. So obesity by itself also is a cause for further obesity. So what are the consequences of obesity from a health point of view? Well, this diagram that comes from the Cleveland Clinic actually can show us that there are many organ systems that are affected by obesity in a negative fashion. This is actually a diagram that shows the benefits of weight loss surgery, but it points at the different illnesses that we can actually get out from by losing weight. Obesity affects almost every organ system, whether it's sleep apnea, whether it's lung disease, heart disease, high blood pressure, heartburn or reflux, inability to hold one's urine, called stress urinary incontinence, joint problems, leg swelling problems, difficulty with fertility, type 2 diabetes, the metabolic syndrome, non-alcoholic fatty liver disease, high cholesterol, all conditions that are directly related to obesity. So obesity is not only a problem of appearance or convenience, it's a fundamental problem of health, particularly when it reaches high levels. So what treatment options do we have for obesity? Well, we can look at the level of obesity. We can see if the person, for instance, is overweight, who's a body mass index below 30. Then we can talk about lifestyle modifications. We can say maybe the person ought to eat certain types of foods, eat in certain times, avoid certain foods, and then exercise more. Those lifestyle modifications can help us lose 10, 15 pounds or so. Now, when the obesity level is higher, or class 1 obesity or class 2 obesity with higher levels of body mass index, then we can entertain lifestyle medication plus prescribing medications that can curb appetite. And then finally, we talk about surgery as a very important component of the treatment options when the body mass index is greater than 35, greater than 40. So different treatment options based on the level of obesity that the person is struggling with. Now we know, and most people have already tried diet and exercise, and particularly when they are trying to come down from very high levels of obesity, when they are about 80 to 100 or plus pounds above their ideal body weight, instead of weighing 150 pounds, which is their ideal body weight, when they weigh 250 or more, they will have tried many diets, and very often they will have failed because they enter this vicious cycle of doing diets and exercise, but then the body tries to defend its level of weight and makes the metabolism slow down, and the person actually ends up gaining weight and end up at a higher weight than when they first started the diet. And this vicious cycle can continue, leading to a person to slowly really come up and down with their weight, but ultimately end up with a much higher weight than when they started. So Very often diets and exercises do not work because the body tries to defend that level of weight staunchly, and it behaves as if it's starving when there is so much excess energy within the body. Well, with surgery, we are able to break that vicious cycle because surgery not only allows the person to eat less and to feel less hungry, but it actually leads to changes in the metabolism. Mediated by chemical messengers that work between the digestive system and the brain to really make the body accept that lower level of weight, and that level of weight can be sustained in the long term as well. So bariatric surgery or weight loss surgery is not only bringing about mechanical changes in terms of diminishing how much a person can eat, but also changes in the hormonal system of the person that will beneficially affect their metabolism so that their weight remains on the low side for prolonged periods of time. So bariatric surgery, who would be a candidate? Well, we talked about that. We said a person has to have a body mass index greater than 40 or greater than 35, but with added illnesses already present, like type 2 diabetes, high blood pressure, or sleep apnea. The person must have tried some type of diet before. We obviously want to make sure that the people undergoing weight loss surgery do not consider weight loss surgery a magic answer. They are not magic answers, they are powerful tools. A powerful tool that is utilized alongside lifestyle modifications, attention to a healthy diet, regular physical activity, and a person who has done previous attempts will have understood that, and they can incorporate that to their after weight loss surgery life much more easily. It's important for a person to understand what surgery involves, and attending this type of seminar like tonight obviously helps in that way. And of course, a person has to be what we call an acceptable operative risk, meaning that they have to be from their heart, their lungs, their kidneys point of view, they have to be healthy enough to withstand an operation, and they have to be ready to commit to a lifestyle of change. So that is the candidate for weight loss surgery.